Hello everyone. I just wanted to start with a quick video because I really need to thank my patrons that subscribe to Anna's tier. Those are Leonardo Titone, Jonathan, and Hazen. I'm so sorry if I say your names wrong, but I'll do my best. So yeah, thank you very much for the support you've been giving me, and I appreciate every single help that I get from you guys. So I hope you stick around and enjoy all the extra content that you get from Patreon. Hi. Hello. I'm so sorry, I'm a bit late. Yeah, I just got stuck in traffic and I couldn't come earlier, so I apologize. If you give me just a minute, I will be ready. How are you doing today? All good? That's great. Yeah, I hope you don't mind. I told the receptionist for you to wait here because I think it's better for you to get used to the room. Okay. Yeah. So if you could just give me a minute, I won't take long. So, how are you feeling? Is this the first time you're doing this exam? No, you have nothing to worry about. You know, this is quite easygoing exam. We're just going to do a few exercises and yeah, just test your nerves, and that's really easy. But I'll go through the steps of the exam with you in a moment. So yeah. So this is your first exam. I will probably just take a couple of information from you and we're ready to go. Okay? Great. Yeah. So I have quite a few details already, so this is good. I remember. Oh, sorry, I didn't introduce myself. No, I'm Dr. Maya. Because I think you've been here before for another exam, right? Okay, yeah. I think I remember you. Because yeah, we have all your information in here. So let's see. Okay, let me just get the other folder. Okay, now this one should be great. I think I have everything in here. Okay. Your address is still the same, right? Okay. Yeah. Phone number is the same as well? Oh, okay. No, I think I don't need anything else. I have everything. Okay, so I'm just gonna tell you a little bit about all this exam and how it works, what we do, so that you feel a bit more comfortable with it, okay? Great. So yeah, I'm just gonna disinfect my hands because that's part of the procedure. So basically this exam, it's to check if your facial nerves are all working as they are supposed to be. So basically we do a few exercises and just basically check if everything is okay, if there is no signal of a malfunction in your nerves. Hopefully we'll be fine, because most people are totally fine with this exam. This is kind of like a routine exam. You just need to check if everything is 100% okay. But yeah, apart from that, you don't need to worry. This is quite simple, yeah. Okay, so we're gonna go through basically everything in your face. We're gonna go through eyes, mouth, nose, ears, everything. So if you're happy with that, and if I have your consent, I will start the exam. Okay. So, what we're going to do basically, I'm going to start with the olfact. I'm gonna test if everything is working 100%, well, in the areas around your nose, basically. So give me just a second. I will just get the testers, and yeah, we can start. Okay, so basically I have a few testers like this, and what I'm going to do is I'm gonna open them and put them close to your nose, and you basically have to identify the smell, okay? This will help me checking all your olfact sensors, and yeah, you ready? Okay, so I'm gonna start with this one. You just need to tell me what smell is this, okay? I'm just gonna get a bit closer, okay? Okay, right. Okay. Alright, so if you could tell me what smell this is. That is correct. That is correct. It's orange. Okay, so the next one. Okay, so tell me what this is. That is correct. Very good. Let me just. Okay, that is great. Just gonna do a couple more, okay? So. Alright, so if you tell me what this is. I know it gets a bit harder. Okay, it's not that hard for you. That is correct. Alright, and then last one. So, if you could tell me what this one is. Yeah, that is correct. Very well. Okay, so you did very well with these ones. Done. Okay. So now we're going to pass to your optic nerve. Basically, I want to check if everything is good with your vision and all your optical nerves. So with this one, we're going to take a few more steps, because I really need to check for color blindness and all the problems that could be possible. So I'm just going to go through a few exercises if you don't mind. That's great. So I suggest we're going to start with the Snellen chart. Yep, this one right behind me. I'm basically going to point at the road that I want you to tell me, and all you have to do is just tell me what you see. Okay? Alright, so let us start. That's great. So if you could just tell me these first two? That is correct. Okay, second row. Can you tell me what you see on the second row? That is correct. Can you see the third row? Okay. Correct. Okay, so let's go up to this one, fourth row. That is correct. Very good. Okay, so we're getting a bit harder, so if you could read this one. Okay, so everything is alright in this one, okay? Alright. Can you read this one here? Very well. That's really good, yes. So then up to this one. Very good. And the last one, can you read the last one? Alright, that was very, very good, yeah. Your vision seems to be perfect. I'm just gonna take a couple more exercises if you don't mind. So yeah, let me just take note of this one. That is great. So the next exercise, basically I want to test if is there any color blindness. Have you experienced anything that could lead to any color blindness or any sign of it? Never. Okay. No, that's great. Yeah, usually we do some tests, of course, if people come in and tell us, look, I have this sign of color blindness, but most people are okay with this, so I'm just gonna do a small test with you. Yeah. Okay. So just that's great. So these are called 𝚂𝚘𝚝 plates, and basically they're little small plates with numbers and forms, and especially they have different colors. So what I'm going to ask you to do is identify the colors present on the card, and if there's a number or a form, I need you to tell me if it's a number or a form, okay? Alright, that's great. So if you don't mind, I'll start now. Yeah, ready? That's great. So card number 1. What do you see? And is it a number or is it a form? That's correct. Very good. Alright. Up to the second one. What do you see on this one? And is it a number or is it a form? Very good. That's 16. That's correct. Okay. Up to the next one. Okay. So what colors do you see in here? That is correct. Is it a number or is it a form? A form, that's correct. Okay, so next one. If you could tell me what color is in this one? Correct. Is it a number or a form? That is great. So next one, if you could tell me, is it a number or a form? Very well. No, you're doing great with these ones. Okay, up to the next one. Yeah, correct. And a number or a form? That's great. Okay, next one. That's correct. And that is correct as well. That's a form. Okay. Number or form? That's a form. Very well. What colors do we have in this one? Yeah. Okay. And is it a number or a form? Very well. Okay, we only have 3 left. So if you could tell me on this one, what colors you see in here? That's great. And is it a color or a form? Sorry, a number or a form? That's great. You see, you're doing better than me. Okay, up to the next one. Correct. And number or form? Number. Very well. Up to the last one. What do we have here? That is great. Alright, so everything seems to be totally fine. So you did great with this exercise actually. Yeah, you know, some people, even if they are not suffering from color blindness, sometimes they have a hard time with these plates because, you know, it turns out to be a bit confusing sometimes, but you did very well. Okay, so let me see. Okay, so next I'm just gonna test your visual field, if you don't mind. Yeah. Okay, so basically what I'm going to ask you to do is just stay still, look at me, and I am going to do some exercises with my hands. I'm gonna wiggle my fingers and I need you to tell me which fingers am I wiggling. If it's the top right or the top left, just let me know, okay? Alright, so I'm just gonna step a bit backwards because I need you to use your visual field, okay? Alright, so ready? Just look at me. Yeah, that's great. So I'm going to start, so just let me know, okay? Very well. Great. That is correct. Very good. Very good. Alright, that's great. That's great that you can detect that. That was the second part of the test. So basically, this helps me to check if your visual field is working in like 100% and if you can detect 2 movements on each side. Yeah, you did pretty great. So, okay. How is it going so far? It's quite easy, isn't it? yeah, there's not much you need to do. Just your nerves should be working perfectly, so anything yeah, if you have anything to be worried about, we would notice. Okay. Okay, so now I'm basically going to test your pupils. I need to check if everything is working as it should. So this exercise will basically be, I'm gonna cover one of your eyes. I'm gonna point a bright light at your other eye, and I'm going to check if the reaction is the one that should be. And there's nothing special that you need to do. You just need to look straight at the light that I'm pointing at you, okay? I know this can be quite harsh for your eyes, so let me know if everything is okay. If not, I can stop at any moment, okay? Great. Alright, so I am going to start by direct the light to your eye in certain directions, and I'm just gonna check how your eyes are doing, and then I'm gonna start with the exercise of covering your eyes, okay? Alright, that's great. So this light can be quite bright, so yeah, let me know, okay? Alright, so that's great. Everything seems to be really good. So yeah, we're gonna do now the exercise. So I'm gonna cover your eye. That's great. I'm gonna point this one at this one. If you just look straight at me. That's great. No, that's great. I'm just gonna give you a little bit of time. Yeah, I know sometimes your eyes with these bright lights is so hard. Okay, ready? Okay, I'm gonna cover this one now. That's great. Yeah. So you seem to be doing fine. Yeah, is there anything that you notice that you wanna talk about? Anything weird that shouldn't be happening? No, everything seems okay. Alright, and how are you feeling right now after the light? Okay, no, that is normal. That is a really normal thing to feel after this exercise, so don't worry about it. Okay, so I'm just gonna have to examine just a bit closer to your eyes, so I'm just gonna put the gloves on. If yeah, that's great. So if you don't mind, I'm just gonna get a bit closer, okay? Yeah, it's just checking. Okay. everything seems really good. Okay. So so our next exercise, I'm just gonna test. This is still for your vision. I know it's quite a lot, but it's one of the really important ones to test. So what I'm going to do is basically I'm gonna draw a figure on with my fingers, and I need you to tell me if there's any double vision. If there is at any point, just let me know, and let me know when it gets worse, okay? Yeah. Okay, so you ready? Okay. Okay, that's great. Everything alright? Yeah? Okay, that's a great sign. Alright. Okay, so next I'm going to examine your face and all your nerves around your face. This will basically be done with a little piece of cotton, and what I'm going to do is I'm going to touch your face in different points, and I'm just going to check the reactions, and if you tell me how or where you're feeling it, that would be great. Okay. Yeah. Ready? Okay. Great. That's very good. That's good. Another one that I have to do. This can be quite hard, but I just want to check the reaction of your eyes. So basically, I'm going to approach your eye really, really close with the cotton, and I just need to check if you have all the reflections working. Okay. Right. Okay. All right. Now that's really good. That's exactly what is supposed to happen. Okay. Alright. I'll check. Now you're doing really, really great, actually. Okay. That's great. So now I am going to actually check your muscles from your face. Okay, so I'm going to touch a few muscles around your face, and what I want you to do is quite a few simple things. So basically I'm going to offer resistance, and you just need to try to open your mouth or close depending on what I'm doing at the moment. Okay. Alright. Ready? Okay. So if you could try to open your mouth. That's great. Okay, so now if you try, just open your mouth. Great. So now if you try to close it. Oh, that's great. Okay. really good. Okay, so I need to test a few more muscles in your face, so if you could follow the instructions and we should be fine, okay? So if you try to raise your eyebrows like this, it's great. Okay, so now if you just try to close your eyes, close your eyes, and now if you just do it really exactly, that's great. So all your muscles seem to be doing really good. Okay, if you could give me a smile, big one. That's great. Okay. I'm just gonna ask you to raise your eyebrows once again, just to. Okay. That's great. Alright. So, everything seems to be great. Now I'm gonna pass to another part of your face, which is the ears. I'm just gonna have to check if everything is alright with your audition. Yeah, so you're gonna start listening some sounds in both sides. I need you to tell me which one is louder, and that's basically it, okay? Alright, that's great. So I'll just grab this. Okay, so I'm gonna go on this side if you don't mind. Okay, that's great. Now on this one. That's great. All right. Yeah. Don't worry. Everything is fine. I am just going to check now your mouth. Yes. How are you feeling right now? You good? Yeah? Great. So I'm just gonna ask you to open your mouth. Basically, I am gonna put this one on top of your tongue, and I have to check all the reflexes. Don't worry, this might trigger the gag reflection, but that's totally fine. That's exactly what we're looking for with this little exercise. It's a bit uncomfortable sometimes, but I just wanted to let you know, okay? Okay, if you could open your mouth. And if you say, ah, that's great. Okay. Yeah, just, yep. No, everything seems to be quite good. So, yeah, open. That's great. Alright. No, that's totally fine. Yeah, no, feel free to ask any questions if you have some, okay? Yeah, of course. So I'm just focusing on this test, but if you have any question at any moment, just let me know. Okay, this is perfect. Okay, so now I'm gonna examine basically your shoulders and your trapezius. That's this muscle in the back. I'm just gonna do a couple of exercises, and I need you to basically offer resistance as you did before with your mouse. That's okay? Alright, great. So basically, first one is for your shoulders. I'm gonna press it and I'm gonna ask you to offer resistance and try to pull them up. And the other way around as well. I ask you to pull them up and then I'm trying to offer a bit of resistance. Then the second one will be with your face. Just gonna ask you to try to turn your head, basically offering resistance as well. Just gonna keep it still. Alright? Great. So let's start with your shoulders, okay? Okay. So if you try to raise your shoulders. That's great. Okay. So now you need to try to push them up. One more time. That's great. Okay, no, that's great, that's great. So now I'm gonna do the same, but with your head. Ready? Okay. Alright, so if you turn your head for your right side. That's great. No, that's the whole point of the exercise, to check if your reflexes and everything is working good. That's fine, no worry. Okay, so now to the left side. Okay, and right side. That's great. That's really good. Okay. Take this step, and I think that's about everything. So one last thing that I would like to do is just to check your heartbeat, if you are okay with that. Yeah, just a routine check. Okay, that's great. So I'm basically going to ask you to breathe in and breathe out. You know how to do it, right? Okay, great. So I'm gonna start in the front. Yeah, if you could just, that's fine, that top is fine. Okay, so that's great. Okay, breathe in. Breathe out. That's great. Breathe in. Breathe out. It's really good. So I'm just gonna go in your back and check it as well, okay? Yeah? Alright, great. Okay, so if you breathe in and breathe out. Once again, breathe in and breathe out. Okay, just once again, breathe in and breathe out. Okay, that is great, really. You seem to be doing really fine. So yeah, all the exercises that I need to do, all the examinations are done, so you can relax. Yeah, everything is really great. Yeah, basically I tested all your nerves and I tested everything, and everything seems to be working pretty well. Of course there are some minor things that we don't really worry about. But yeah, you will get basically the results with everything specified in there, and you will be able to look at it and see what points are 100% and which ones are like 98. Okay. And how did you feel? Yeah, it's quite easy, isn't it? Okay, so I'm just gonna Yeah, just checking if I had everything. I'm gonna ask you just to, yeah, just to sign. This is just a, okay, so if you could just sign in here and in here. Thank you. Thank you. That's correct. Okay, so this one will be for you. Let me just take the one that's for you. Okay, so this one you can keep it with you. That's just the basic result of your test. It says like all the fields that we went through, all the nerves, every specific part is there, and yeah, nothing to worry about. Everything is totally fine. You did really great, actually. Yeah, you know, there's lots of patients that they come in here and they really think they have a problem with some of the facial nerves, but it's actually quite a normal or a simple thing that happens, and they think they have a problem, but it's actually not like a thing to worry about. Yeah, I get what you're saying. Yeah, it happens a lot, totally. Yeah. No, there is nothing else to sign or to check. Yeah, it was really a pleasure to do this test with you and to be your doctor today. I hope we can meet again sometime. Of course. Yeah, there's a few more routine exams that you should probably do in a few months. Yeah, within the 2 to 3 months from now. But if you could just check in the reception desk, they will tell you which ones are you suitable for and which ones you don't really need. Yeah, it depends on your age and all those factors. Okay, well, it was great seeing you, and see you again sometime. Thank you. Yeah, I'll walk you too.